Welcome to the Propaq MD Non-Invasive Blood Pressure Module. There is a full range of cuff sizes available. Neonatal sizes 1 to 5 are intended for single patient use. All other cuff sizes are available for single or multiple patient use. Exchanging cuffs for different patient sizes is easy. Simply insert the plastic connectors on the non-invasive blood pressure hose into the cuff hose connector and twist the connectors until they lock. Following a few simple principles will maximize NIBP accuracy. Always select appropriate NIBP cuff size. Cuffs that are either too small or too large will skew NIBP readings. Use the left arm if possible. Always position artery indicator over or as close to the appropriate artery as possible. Rule of thumb for NIBP technology: if a provider can reasonably auscultate an NIBP assessment through an article of clothing, the machine should provide an accurate assessment. If you cannot reasonably auscultate through an article of clothing, the machine will not provide accurate assessments. As a rule, NIBP measurements taken through multiple layers of clothing are inaccurate. Encourage no movement of the patients during the measurement. To use the Sure BP feature, which enables the Propaq to measure blood pressure on cuff inflation, you must use the FlexiPort cuff and dual lumen hose. The device is backwards compatible with the older Welch Allen NIBP single hose, but the unit will only measure blood pressure on cuff deflation. As well, you will not have the ability to take advantage of the newer features available with TurboCuff and Sure BP. Attach the inflation hose's threaded metal connector to the NIBP connector on the side panel of the Propaq. Turn the connector in a clockwise direction until it is snug. Before taking an NIBP measurement for a new patient, ensure that the cuff inflation settings are appropriate for that patient. Check that the correct patient mode is selected. After each NIBP measurement, the Propaq unit adjusts the cuff inflation pressure to optimize the next NIBP measurement. You can specify the appearance of the NIBP numeric display format. The display format allows you to choose whether or not you will display map measurement with the systolic and diastolic measurements. The last step in preparing to perform NIBP measurements is to ensure that the necessary alarms are enabled or disabled, that alarm limits are appropriate, and that the NIBP settings are correct. Use the navigation keys to highlight and select the NIBP numeric display to display the NIBP parameter control. In manual mode, the Propaq MD takes a single NIBP measurement when you press the NIBP button on the front panel. You can specify that the Propaq MD unit operates in either manual or automatic mode. Use the NIBP control panel to choose a mode. In automatic mode, the Propaq MD takes the first of a series of NIBP measurements when the auto interval timer expires, and then repeats the NIBP measurement at the specified interval. You can specify intervals of 1, 2, 3, 5, 10, 15, 30, and 60 minutes between NIBP measurements. The NIBP key initiates or aborts a single blood pressure assessment. The user presses the button once to initiate the NIBP assessment process. During the assessment, if the user presses the NIBP button, the current reading will be aborted. Single stat assessments or aborting readings does not affect NIBP auto mode. NIBP measurements can be adversely affected by many factors, such as cardiac arrhythmias, sudden changes in blood pressure, body motions such as shivering and convulsions, bumping the cuff, vibration, vehicle motion, or weak pulses. The Smart Cuff Motion Artifact Filter increases the accuracy of NIBP measurements when motion artifact or weak pulses are present. The Smart Cuff filter synchronizes the NIBP reading with the R wave of the patient's ECG to eliminate noise created by patient motion or vibration. There are situations where you may choose to disable Smart Cuff. These may include certain types of arrhythmias, situations that prevent getting an ECG signal. NIBP measurements can still be performed with Smart Cuff disabled. Use the NIBP control panel to disable or enable the Smart Cuff function. Selecting Start Turbo Cuff starts short-term automatic, STAT, NIBP measurements. The Propaq MD unit begins its first NIBP measurement, after which it continues to perform as many NIBP measurements as possible over a 5-minute period. Select Stop Turbo Cuff to immediately stop STAT measurements. Use the NIBP control panel to start or stop the Turbo Cuff function. You have reached the end of the Propaq MD non-invasive blood pressures module. For additional information on the other Propaq MD features, please review the corresponding module for those details.